The city reported 5,564 COVID cases today, slightly more than yesterday. 385 of the cases were imported. Meanwhile, a study conducted by the Chinese University Medical Faculty found that 70% of recovered COVID patients suffered from long COVID. Speaking to TVB News, Faculty Dean Professor Francis Chan said long COVID could have a significant impact on patients' work and school performance. Christy Khan has more.
Since the start of the COVID pandemic, more than 1 million Hong Kong people have been infected with the virus. A study conducted by the Chinese University's Faculty of Medicine found that 70% of some 7,000 respondents who are recovered COVID patients have suffered from long COVID. According to preliminary statistics, around 40% of respondents said they experienced anxiety, depression, and difficulty in sleeping. Around 20 to 30% of respondents said they had symptoms such as dry cough, shortness of breath, or hair loss. Among the respondents, females and those aged 65 or above had a higher tendency to develop long COVID. But does that mean long COVID is inevitable? The medical faculty's dean of the Chinese University, Francis Chan, said in a TVB program that there's a way to help.
For those who had vaccination received, the risk of having long COVID is much lower than those who never received vaccination. So I guess this is something very important that we have to bear in mind, that vaccination is a rather effective way of preventing long COVID.
Additionally, Chan said there's a way to precisely identify whether a recovered COVID patient was affected by long COVID.
Nowadays, actually, we can assess the patient's stool specimen to make a diagnosis, because we found that long COVID is associated with a very specific changes in the gut bacteria. There's a very strange pattern of imbalance between the good and the bad bacteria.
He called on the public as well as healthcare professionals to identify this long COVID problem at an early stage so that symptomatic treatments can be offered to these patients as soon as possible.
I believe that we need to realize the importance of this problem. Although one can argue long COVID is not life-threatening, but if you think about the sheer number of people being affected, it will be an important burden to our healthcare and also a negative impact on our societal productivity.
He suggested special long COVID clinics be set up to provide support and treatment to these patients. Christy Khan, TVB News.